Good morning, everyone. Firstly, it's like, seeing you guys here on the Sunday morning is really energetic. And it's really motivating me to make the parent discussion more, you know, like to make it more great. So let's start. Firstly, our topic is today burnout syndrome. So as we have Dr. Pratibha, let's start with her first. Okay, Dr. Pratibha, let's first tell what is burnout syndrome and what are the symptoms of it.
Thank you, Ruhi. I just want to clarify that I'm a counseling psychologist. I am not a doctor, but I have a master's in psychology. So I guess people like to address psychologists with that. So just wanted to clarify that. And before I begin today, I would like to thank PSF for inviting me today here and to be a part of this esteemed panel. And also to see, it makes me really happy to see so many people on a Sunday morning interested in learning about different topics. And that would, help in your growth. And it was mentioned earlier, it is the growth mindset that will get you to where you want to be. And yeah, thank you. And also the fact that you all are interested in a topic that is often ignored, but it's really important, the burnout syndrome. So before I dwell into that, I'm looking forward to engaging in a very meaningful and engaging in a conversation that gets you to think in many ways and also to improve the environments that you're working in, and also the organizations who are here, entrepreneurs, how to make your environment suitable for your employees. Okay, so to start, what burnout syndrome means is basically it's been, so according to International Classification of Diseases, ICD-11, the World Health Organization defines burnout as a syndrome resulting from chronic workplace stress that hasn't been addressed successfully. It is important to know that burnout is not limited to professions at workplace. Even world-class athletes, Olympic level, athletes and doctors and nurses, homemakers, regardless of what professions you might be, dealing with, you can be afflicted with this syndrome. Especially, I would like to say that people who are dealing with a helping profession or dealing with people or a service industry, they seem to be feeling the syndrome more than the others. The burnout syndrome is characterized by three distinct telltale signs or symptoms. First being extreme exhaustion, and second being feeling of negativism. Third is inefficiency at one's job. I will take maybe a minute or so to explain this a bit. So extreme exhaustion, what it means is, this is actually most common symptom of burnout that people face in the world today. It is something that gets built over a period of time and it accumulates. Constant work pressure, having unrealistic expectations from the stakeholders, and getting work into work that is kind of get monotonous after a while. That causes extreme exhaustion in people. Now, feeling of negativism, what it means is when a person is not anymore interested in what they're doing, that they were interested in doing before. There is increased absenteeism, cynicism, lack of interest, and apathy in what they do. So it all contributes to brewing condition of negativism in employees, and sometimes even it could happen to even entrepreneurs. After a while, they might lose the focus. They might feel, what am I doing this for, right? So third one, is inefficiency at one's job, difficulty in concentrating at what you're doing. There is indifference, there is boredom, there is apathy, all cause an individual to not be successful at what they're doing. And in addition to this, I would like to mention that burnout is also accompanied by changes in appetite, changes in sleep patterns. People experience insomnia, and they experience physical health issues and sometimes increased use of substances like alcohol, nicotine, or drugs. So these are this is the definition and some of the symptoms of burnout syndrome. Yeah.
Okay, Dr. Pratibha, I would still again like to call you doctor. So, okay, just for now, because I like calling you that. Okay, fine. So, Mrs. Somu, that that's been really good idea about what burnout syndrome is, and also the symptoms that we face. And according to me, this generation really face a burnout a lot due to the work culture and the workload, etc. stuff. And now I would like to know from Dr. Lavanya, what are the causes of burnout according to you?
Yeah. So first of all, thank you for having me over, and I'd like to appreciate and commend Professional Solidarity Forum for accomplishing whatever they have accomplished till now, and I wish them all the best for the future events and endeavors. And I congratulate everybody who is involved in putting this event together today. I know I congratulate all the participants as well. As everybody mentioned, being a Sunday, being here whole day is a great achievement in itself. So coming back to burnout syndrome and causes of burnout syndrome, I'm a sleep physician, so my importance is biased towards sleep. So I'll keep that for the end. But there are a lot of other factors that contribute to burnout syndrome. So I'll go over a few which are commonly experienced by many of us. So one is workload. Not knowing one's capabilities and capacities, and taking up a lot of work, and when it gets to a point where it becomes overwhelming, that leads to burnout. So one needs to understand what their capacities are and capabilities are. Next is reward. So being rewarded is satisfying, is gratifying. So when that does not happen at work, reward could be as small as just an email from a colleague or your boss or your supervisor, or it could be a pay rise too. So it doesn't have to be a big thing, even a small thing. So being rewarded, if that doesn't happen at workplace, so that leads to burnout, and even in a faster way. The next is your work environment itself, appreciating and having trust in colleagues. That helps a lot, and it boosts the morale of the team. So being appreciated does help a lot, and when that happens, it does lead to burnout syndrome. The other more important one is lack of support. So when one feels isolated at work, also in personal life, when somebody does not know who to turn to, who to talk to, that leads to burnout even faster. These are all contributing factors, one, or it's usually multifactorial. They all add up together. There's another one, work-life imbalance. So when most of your time and energy is being taken up by your work and whatever you need to get done at work, you have lesser and lesser time to spend with family and friends. That leads to burnout even faster. So these are all the work-related factors that contribute. So I am going to go back to the sleep. So what happens when you have to accomplish something, or what happens when you have to do a presentation like this the next day? What do I compromise on? The first thing that comes to mind. sleep.
Definitely.
Exactly. So that is what you compromise on first. And there's a survey done by Nielsen in, this was done way back. It was done in 2009. And the numbers then itself were alarming. So I would imagine the numbers would be worse now. So just to give you a gist of the survey, this was done in over 5,000 people in the urban and suburban population in India. And more than 93% of the population who were involved in this survey, they were sleep deprived. And more than 50% said it did affect their work. And about 11 to 20% even took time off from work to feel better. So this was in 2009, and I'm assuming after COVID and the stress levels becoming worse and worse day by day, the numbers would be even higher in this day and age. And also to add to it, what do we think? I think if I have to get this work done on a weekday, I'll compromise on an hour of sleep or 2 hours of sleep, and I'll make up for it over the weekend. So that's what we all think, right? We will take a nap on a Saturday afternoon or a Sunday afternoon, and we'll be fine. But studies show that if you lose 1 hour of sleep, it takes 4 days for you to recover from whatever damage that loss of 1 hour of sleep has done to your body. It takes 4 days. So imagine if you're cutting on your sleep on a day-to-day basis for a long period of time, months to years. How long does it take for you to clear all that sleep debt? And this sleep loss makes the stress even worse, makes how you deal with your stress is also affected because of the sleep loss. So these are all the causes.
But according to you, sleep is one of the most cause.
According to me, yes.
Sleep is.
See, if you think about it, 1/3 of your life
You spends on sleeping.
So, and that 1/3 how you spend and the quality of that 1/3 affects your other 2/3.
According to you, what is the best time sleep, and how many hours a person should sleep in a day?
So that is a very common question that people ask. Best time is we sleep in the night. We are not
Yes.
nocturnal beings, so we sleep in the night. So nighttime sleep is the best. As much as possible, nighttime sleep is the best. And how much sleep do we need? It varies. See, for example, babies sleep almost 20 hours a day. By the time you get to a year old or 2 years old, it becomes 14 to 16 hours a day. Kids, school age kids, 10 to 12 hours at least.
Yeah.
And on an average, an adult requires 8 hours, but 8 hours is not a magic number.
Yes.
It could vary between 6 to 10 hours, but anything less than 6 hours or anything more than 10 hours, there's something that you need to look at deeper, go dig deeper.
Okay. So I completely get it now about the sleep pattern. Now, Mr. Shafeeq, as you have an experience of approx 2 decades in corporate world, as we know that nearly 78% of corporate workers experience burnout. So what do you think could be the reason for it?
So there are various causes for this burnout, especially at workplace. And if you look at the main causes, the main ones, the first one is the difference between or the imbalance between job demand and the job resources. Now, let me help you understand this. Job demand is nothing but it is the overload of work, right? There are certain additional responsibilities given to you, and the job resources here is there is not enough autonomy given to you, right? And in this situation, you are actually caught up with certain stress, right? This is one of the main causes. And the second cause is the difference or imbalance between or a mismatch between job and skill. Now, job is the job which you are required to do, which you are in or which you are opting for, and the skill is the skill which you actually possess to do the job. Now, if there is a difference between this, which means that you're not able to deliver what you're expected because you does not possess that required skill. And if you're already in that job, then what you tend to do is you tend to create some stress there. And stress, normally when it is prolonged stress and excessive, that leads to burnout, right? Now, the third main reason here is, as our experts have called out, our work-life imbalance. very often, we tend to carry our work pressure at home, and then, home activities at work, and then somewhere, it loses the balance. The moment it impacts on the balance, that's where you start experiencing the stress, right? And then the other reason is, you all agree to this reason, are toxic managers. Our managers tend to kind of, provide a lot of push on us to complete our goals, our responsibilities. At times, we're not given enough guidance, right? We don't know which mountain to climb, and then we search for some mountain and start climbing. And then suddenly, during our year-end reviews after the entire year, we tend to kind of, get all the negative reviews. So this also creates a lot of stress. If you don't have a great manager, not everyone has though, but it definitely adds to the stress. So lack of recognition, and then lack of resources, and apart from that, toxic workplace. So all of this account for stress, and the long-term stress, prolonged stress, creates the burnout. So all of this also, what it does is, to an employee, employees, when he or she sees this happening at workplace, they tend to start feeling undervalued, right? There's no recognition, right? And then there is like a non-inclusive biasness at the work, and this all the individual will experience through their co-workers and their leaders. So that's where it all adds up to the burnout, syndrome at workplace.
So it is, according to you, so it is individual responsibility, or no, or like, where we are working, the management responsibility too?
Certainly it is employer's responsibility. And if you look at, World Health Organization has called it as occupational phenomena. However, while it is organization's responsibility to solve it, and many organizations put a lot of efforts, I'll call out a couple of them later. So it is a responsibility of both employee and employer, right? And if it is done in collaboration between employee and employer, it gives great results. And if it is just employer who's putting efforts and the employee does not accept it or acknowledge or support, then the results can take more time, right? Or if employee individually is putting a lot of efforts and the entire culture of the organization does not support, it will not happen, right? It creates more stress. So to answer your question, it is definitely the organization's responsibility. In organization, it is leadership, management, who needs to take this account of and needs to actually work on it.
So one must should take care of themselves as well as it's a organization responsibility too.
Yes, organization also does a lot of various activities. If you look at in last 2 years, especially after pandemic struck, many organizations have started kind of looking and go deeper into this area. Right? There are organizations who have actually changed their policies. Right? They created this hybrid work environment where you are allowed to work anywhere. Right? Flexible working hours actually gives you a lot of options to work whenever you can work. Second, the policies, the insurance policies have changed. There are a lot of education awareness sessions which are organized by the organizations to create awareness about what stress is, like this one, right? Or how to balance the work-life balance, right? All of this are kind of covered. However, there is still a lot of other activities where organizations kind of slightly haven't really ventured into. Probably I'll just discuss that a little later, but yes, organizations have started addressing this at a large level, and there are more organizations needs to kind of follow this, and there are many other activities which organization also needs to do to kind of address this at a larger level.
Okay, thank you. Audience, I'm very sure that you guys must have a lot of questions on burnout. So keep your questions ready. We will take your questions at the end of the session. Now I would like to ask Mrs. Somu, many people consider depression and burnout similar. So what are the differences, and how they are linked, and what is the exact difference between them?
That's a great question as well. So burnout has a very definitive external cause to it, whereas depression is caused due to one's internal experiences, which might be occurring without any definitive cause aligned to that.
Okay.
So in burnout, as Mr. Shafeeq also pointed out, and according to ICD, the main cause of burnout is the occupation of a person, right? So once you remove that, let's say the stress in occupation, the burnout symptoms tend to go away.
Okay.
Whereas in depression, even if you remove that stress factor, the depression tends to linger longer unless other areas are not tackled with.
Okay.
So that is a key difference. that one is external, the other one is more to do with internal factors.
What will be the external internal factor if you elaborate little?
Yes. So let's say, so with burnout, I mean, I would like to add another point. With burnout, it doesn't really mean this would lead to depression, but
Okay.
you are prone to episodic, incidents where depression-like symptoms can work.
Okay.
Can happen. Now, that doesn't mean that you would get a clinical diagnosis of depression at that point, but you are prone to it.
Okay.
But depression doesn't lead to burnout. So it's
Mhm.
important to decipher both, that there is a difference between these two. And then also the burnout, like we all discussed here, when there is a lack of work-life balance,
Hmm.
when your boundaries are blurred by what your responsibilities are like, and there's a lot of expectation, and the expectation is varying. It keeps changing from one organization to the other, or to your manager. You're trying to live up to all those expectations and not knowing what you're trying to achieve there, right? So
Yeah.
burnout happens at that point. Now, if you change that leadership, if you change, let's say, the environment around where you are, then you can see some reprieve in burnout symptoms.
Mhm.
Right? With depression, that's not the case. There's a lot of internal work that needs to happen. And medication that needs to be, in case it's required. Medication, with medication, psychotherapy, depression can be managed. Whereas with burnout, it's different.
When do you think a person should seek help, like, either therapy or help from others when they feel burnout? What will be like a stage when they should approach for help?
Yeah. So like I mentioned before, it takes a while for burnout syndrome to come about. When you're facing the stress and you are, you're not able to cope, that's when you need to find ways how to address that stress. If you have reached out to, let's say, your manager and spoken to him or her about, okay, this is what I'm going through, and communicate that clearly, then perhaps they could help you, right? Just in case that doesn't happen, and the organization is just not supportive, and you don't have social support, you don't have family support to talk to, then that's when you really need to seek out help professionally, either by a doctor or a therapist.
Okay,
Yeah.
so basically burnout is not a medical condition, whereas depression is.
Absolutely. It's a
But-
commonly agreed thing that burnout is a workplace issue.
Yeah, so if we just check up with our environment and other stuff, then burnout can be solved within
Absolutely.
ourselves.
Yes. Yeah.
Thank
And
you.
also in personal life, like you have
Yeah.
to strike that balance.
We need to find out in our self-care what we need to do with ourselves to fix it.
Absolutely. Yes.
Dr. Lavanya, as you are sleep expert, like in my next question to you according to the sleep, like what will be the direct and indirect consequences that put an impact on burnout?
It does cause a lot of direct and indirect effects on one itself. Direct being when one experiences unrestorative sleep, meaning you're getting enough sleep but you wake up unrefreshed, like you haven't slept at all, fragmented sleep. You wake up too many times in the night, and sometimes you do fall back asleep, sometimes it takes a long time for you to fall back asleep. Insomnia itself, insomnia could be sleep initiation insomnia, which means, do you know how long it takes for a normal person to fall asleep once you hit the bed?
It depends on like their nature, like 10 to 15 minutes is enough for a normal person
So
according to me.
20 minutes is the normal. If it takes longer, say 45 minutes to an hour, that means it's called sleep initiation insomnia. It is
Okay.
taking longer for you to fall asleep. There's another thing called sleep maintenance insomnia. So you do fall asleep within the 20-minute interval, but you keep waking up in the middle of the night and you're unable to fall asleep lying in bed with thoughts. So these are the direct
Causes.
effects of stress. And also, there's the burnout syndrome is comparable to shift work syndrome when it comes to effects on sleep and effects on an individual. So in shift work, what happens is people who are doing shift work, like people who are in healthcare industry or public safety sector, or for that matter, even IT, when you're working in different time zones, people experience, more than 50% experience gastrointestinal symptoms, like indigestion, acid reflux, acidity. So all these, the 50%, it means 1 in 2 people probably suffer from these symptoms when you're doing shift work or when you're working odd hours or long hours. Other than that, more than 30% of them experience high blood pressure, diabetes. These are the direct effects, apart from anxiety, depression, and all those things. There are a lot of indirect effects also. So when one has sleep loss or disturbed sleep, body undergoes a lot of changes. So what happens is when you wake up unrefreshed or when you don't get enough sleep, your hormonal, there is a hormonal imbalance in the body. When I say hormonal imbalance, it's not the thyroid hormone, or they are all affected, but I'm specifically talking about the hormones that control your hunger and your appetite. So when you don't get enough sleep, you wake up with greater levels of hunger hormones. So you eat more, you metabolize less, you gain weight, and when one gains weight, it leads to something called another sleep disorder called sleep apnea. So we all snore, a lot of people, I wouldn't generalize it and say we all snore, but at least one person in every family snores. So that is not a sign of good sleep. It is a symptom of sleep apnea. So what it does, obesity does, is it predisposes one to sleep apnea. And when you develop sleep apnea, it again contributes to weight gain. So it becomes a vicious cycle. All these things that I've just discussed, anxiety, depression, obesity, sleep apnea, all these become a vicious cycle. Bad sleep leading to all these things, leading to worsening of, again, all these conditions. So there are a lot of direct and indirect effects of sleep loss and disturbed sleep and deprived sleep on not just the psychological aspect, but even the physical aspect of one's health.
Okay, so basically sleep is not necessary, a good sleep is necessary for a human being.
Yeah, it is not an option, it is a necessity.
It is a necessity that most of the people in this generation don't understand, and we find a lot of youngsters who have bad sleeping patterns, which really affects. We don't find it like, we feel like it's normal, but it's actually not.
Yes, that I think we'll get to it later. I'll talk about sleep hygiene and what we can do for better sleep
Sure.
when we get to that.
Yeah, sure. Sir, for if we see a normal people like housewives or anybody, a normal people, students and other people, when compared to these people or people who are working professionals, they are fine to be have they are fine to be have more burnout. What could be the reason behind that?
Yeah, again, if you look at the causes for the burnout, actually would remain same in most of the situations. There are a few unique characteristics also as part of burnout. Now, if you are working as, if you're just working alone, right, working from home, or if you are running a small enterprise, right? Now, in that case, what happens is you tend to kind of over-expect from your own self. Like, you got so aggressive goals, and you need to go behind those goals. And then you start adding stress to your role, right? It's not the external forces, rather it is purely internal. Now, the burnout and stress purely connects to the role within. Now, if you're a manager, right, now you're putting all your efforts to do what best is required for the team, for the organization. The team does not really possess that kind of skill, right? Now, somewhere you need to kind of upskill that talent, upskill those resources. Now, if the organization is not supporting, or if your manager is not supporting, or the organization policies does not really support you in whatever you want to do as a manager, then you start adding stress to your role, right? Similarly, if you got housewives, who's got really great, responsibility to take care of their family. In addition to that, if they are either working from home or coming to office, in all of the situations, they carry more stress. Now, how do you manage? It's definitely something, which they need to really work on it, and organizations play a key role, as I told you earlier. But yes, to answer your question, we tend to see little higher stress, especially in those, especially the female employees who tend to kind of, who are housewives, taking care of their family and also working, right? And, apart from this, if you look at, in general, organization do support, those, female employees with various initiatives. It may not be enough all the time, right? It still goes back to what you are achieving, what is your goal, what is your responsibility. Because organization would not really change the role or change the goals just because you're a housewife or you're carrying that extra responsibilities. Even men, they're taking care of their family, taking care of their kids, or got, some additional responsibilities which they need to kind of, take care of it. And then, they can't just slow it down. They can't dial down. They can't say that, okay, this year I want to kind of, perform only 3 goals out of 5. Your organization won't allow it. So organization somewhere at certain point, they expect everyone to achieve what they are required to achieve, right? And everyone needs to put that efforts. Now there are smart individuals, smart employees there who kind of manages it really well, right? They put forth their family preferences on top. Whatever happens, right? I'll not let my family down, and I'll not compromise on the time which I am giving to my family. Second, they also chase their goals, their professional goals. Third, they always seek time to upskill. Right? Upskilling is really an important aspect here, because what happens is our job demands keep changing. The skills what we used to hire, especially in I being in HR, when I used to hire say 5 years, 6 years, or even 4 or 5 years back, those skills are hardly seen now, right? I mean, the technical skills, even if you look at all of you are technical professionals. So when the skills are changing so rapidly, it is imperative for you as a professional to keep upskilling. The moment you upskill, you also feel a sense of satisfaction that you are up to market, and then you are doing whatever is required for your career growth. So learning actually makes you really motivated, and to some extent curb this stress, right? I don't know if I answer your question, but yes, stress affects every profession, be it IT or if you look at even our police or fire department, right? They are highly stressed. We don't really realize what kind of stress they are going through. But again, since we are talking about our professionals here, and you take long calls, right? You affect your sleep, and then what kind of sleep disorders you kind of go through it, right? And second, the moment you take little higher workload, then family is asking time for you, right? They don't really know what kind of situation you are in, and how do you really balance that, right? And you got a new manager. Your managers can be like at a different stage of their career. A new manager, like for example, I just got promoted as a manager. Now my organization hasn't really invested in me to make me an effective manager. Now what I tend to do is I put pressure on the team. So I want to be the best manager. What I do is I make my team work 12 hours to deliver whatever is required. Then automatically what I'm doing is I'm actually putting my pressure on the team pressure. And the team eventually result in stress. These are various situations, right? And then it is really important for us to realize where we are in that stress situation, to manage it or to control it.
Just to add a fact to it, what you mentioned about women multitask, and they need an hour of extra sleep than their contemporary men. So
Okay, so basically, as per you, we need to check on people, either it's professional life or personal life. We need to check on people, are they doing fine or not. That could also, help people to do fine. So now we have talked about the problems and what are the causes and consequences of it. Let's come to the solution of it, and we can get to know more about its tips or solutions. So Ms. Somu, according to you, what are the different ways of preventing this syndrome from occurring?
Since we are focusing on burnout syndrome,
Yes.
I'll address that first.
Yes.
So first and foremost, foremost way to prevent burnout syndrome is to have clear boundaries in your work and personal life. You need to be able to do that by communicating that clearly early on
Yes.
in your jobs and have clear expectation of how many hours a person need to give
Realistic
in, and
expectations.
realistic expectations, and this needs to come from employees and also from employers
Management.
and the management. And since this is almost like a pandemic by itself, the
Yes.
burnout was seen a lot.
A lot,
during
yes.
Yeah. And to manage that, I guess now the work environment is more supportive of that. They are willing to listen, and they're willing to incorporate all these solutions for them. So
Yeah.
having clear boundaries is something that a person needs to focus on constantly in case they're getting blurred in between. So and also it is important that one needs to know that this is not be all and end all. There's a lot more to life than work. So
Yes.
we need to make sure you are engaging in activities that are bringing you joy apart from what you're doing for 10 to
Definitely.
12 hours. Like initiatives like how person enabling things that PSF has been doing, it's a
Yes,
great
definitely.
way to unwind and learn skills that you haven't learned before. So it's important that you focus on being on a journey of learning constantly and also enjoying that while you're doing it. So that's the second part of it. And I would also like to add that, having a hobby is important. Having your creative, side being harnessed is extremely important. So engage in something that, that you've been putting off for a while. Like when you were young, you probably had a skill that, you utilized it back then, and now you're ignoring it because of the fact that you're too busy. So, go back to that.
Self-time, you would say.
Yes, yeah, go back to that. Give yourself some time to unwind and focus on something that makes you want to, do something to relax.
What could be something like according to you?
Yeah, so it could be, if you like reading books, go back to reading books. If you like, playing a musical instrument, do that.
Yeah.
Now, if you like to, again, like PSF's been doing, I'm not trying to, promote this, but this is something that was running through my mind when you said social service. It's extremely important to engage in some altruistic activities without expectations, because it is great not only for your community, your society, but for your mental health. Because you're doing something for someone else that actually indirectly brings you joy. We don't realize it, but it happens. So it is really important to focus on these activities. And also, it's important to do some mindfulness activities, which are, for example, meditation. Now, for some people, meditation might not be the thing, but prayer might be. So if you are into that, having some time every day to focus on, not trying to focus on your thoughts, but to do something mindfully is important. So be it meditation, prayer is sort of meditation for a lot of people. So if that is easier, do that, because it takes you away from what you're doing and focusing on something more positive,
Yeah.
right? So it's something that can be easily incorporated. So I think that's another idea there to help prevent burnout. And also, I think Dr. Lavanya would address this later. Sleep hygiene is extremely important. So what I understood about sleep hygiene is like this, like end of the day, body needs rest. We are animals, end of the day, and we
We
have
need
to,
rest.
yeah, we all know that species that are less advanced than us, they also rest. Because when they rest, what happens is all their cellular, growth gets, it gets initiated, and a lot of cleanup happens. So it's important to have that rest period so that you are refreshed and ready to take on the task next day. So not to ignore it, And it's extremely important that you pay attention to how you are managing your sleep. And also, and it's been mentioned before, be kind to yourself. Have that self-compassion, be empathetic and collaborate, and also engage. So I guess I'm like how Mr. Srinivas put it earlier, EQ is important in order to prevent burnout.
There are even
Yeah.
some people who are introvert, like they don't like to talk to people when they are feeling low. What
Right.
advice you give to them?
So the thing is, it's important to reach out. Even introverts reach out to one or two people.
One or two people. That
right?
one or two people is important in their
Right.
life.
Have that social network for yourself. Have that support system. Whether it's your family, whether it's your friends, whoever you can tap into, just be, reach out to them. Don't
Yes.
ignore it. Because the moment you ignore, this can lead to a severe issue that would take a longer time to resolve. So take care of it. And in case you're not able to do that with your own faculties and resources that are available to you, reach out to a professional at that case, in that case.
In that case, that would
Yeah.
be considerable.
Yeah.
So key points would be one must take care of themselves and
Right.
give yourself time, which do whatever makes you happy, either painting, reading books, etc.
Mhm. Right. And also exercising, eating nutritious food is
Eating good food.
yeah, good food, I mean, not laden with high salt, fats, and things like that, not the junk food, but nutritious food that has more of vegetables and fruits and something that has not been altered or processed and close to the nature is what is recommended. Yeah? So,
Okay.
I hope I kind of addressed few points, and I would like to.
Yeah, definitely. You
Dr. Lavanya.
gave us a very good points that definitely help a lot of us for a good, to keep us in a good condition from preventing us from burnout. Dr. Lavanya, as your sleep expert and you are liking to talk about sleep a lot, I just have a question for you. What measures one can take, for a better sleep?
So we all need to follow something called sleep hygiene rules. It's a set of rules, about 10 rules. Starting from childhood onwards, it is better if it is practiced as early as possible in life. So I'll go over a few of these rules which are very important. One is regularity. So our body has a clock inside. It's called the biological clock or the circadian rhythm. So it needs its time, and it is set to a schedule. So not messing with that schedule helps you sleep better. What I mean to say is, go to bed at same time and wake up at the same time. Saying you go to bed on weekdays at 10 and on weekends at 2 is not acceptable. 1 hour variation is fine, but especially when you have a problem, and especially when you don't want to have a problem, want to develop a problem. So regularity is the key to maintain your biological clock and your circadian rhythm. The second thing is screens. So we are all used to, like
Habitual
Mr.
to
Srinivas Rao Garu said, the most important thing is
Wi-Fi.
Wi-Fi.
And mobile.
So we all have our screens in bed. We look at our phones, we look at our emails, we check our messages, we watch TV to fall asleep, and we do think that helps us fall asleep. A lot of people come to me and say the TV is on and that helps me fall asleep. But the blue light does not
Exactly.
help one to sleep, and it actually
Stops, yeah.
yeah, so we mentioned about the biological clock, right? So when it is time to release a hormone called melatonin, a substance called melatonin, which tells the body to sleep, this blue light negates the production of melatonin. So the melatonin is not produced, and the brain doesn't understand that it's nighttime and we need to sleep.
Okay.
So that is the effect of blue light on our brains and sleep. The other things are avoid caffeine. Some people are very sensitive to caffeine. Some people can take an espresso and go to bed. So recognize how sensitive you are to caffeine and avoid it. If some people stop caffeine by noon, some people take an evening cup of tea, that's fine. But you need to recognize when to stop your caffeine intake during the day. Other thing is exercise. So regular exercise is an important sleep hygiene rule, and the timing as to when you exercise during the day is also important. Because if you exercise during later part of the day, the sleep gets impacted. And for all these sleep hygiene rules, there are scientific reasons. So to explain the scientific reason, when you exercise, your body temperature goes up. And for you to fall asleep, your body temperature has to drop by 1 degree to 1.5 degrees. So when your body temperature is up after exercising, it again makes it harder for you to fall asleep. So exercise in the morning is the best. If you need to exercise in the evening because of your work schedule or your social life schedule, at least 4 to 5 hours gap between exercise and your bedtime should be maintained. Saying that, your dinner time also is important. Light dinner is preferred, but whatever dinner you eat, we usually recommend 3 hours gap between dinner time and bedtime. There is a scientific reason, but I won't go into all that. It's going to take up most of the time. So these are the few things. The other thing is nicotine and alcohol, as Pratibha just mentioned. Nicotine, you think it relaxes you, but it's actually an activating substance. So avoid nicotine, especially during bedtime. And alcohol, how many of you think alcohol helps you sleep? So alcohol, it does not help people sleep. It affects sleep in 2 ways. One is when it is getting metabolized, it produces an activating substance, and people wake up after 2 or 3 hours of sleep, and rest of the sleep is messed up. And the other thing is, I mentioned about sleep apnea a few minutes ago. Alcohol worsens sleep apnea also. So all these, if you avoid and follow best practices, meditation is another thing, relaxation, mindfulness, exercise. The other thing is, because it's burnout syndrome and we are talking about stress and how the mind is active, if your mind is really active and thinking about things you need to accomplish or things that are bothering you, we ask our patients to do something called a brain dump. So before going to bed, 1 hour before bedtime, you're switching off your screens anyway. So before going to bed, write down everything that you need to remember the next day or you need to accomplish the next day. Or even if there's something that is bothering you, you're not going to do anything about it, but something that is bothering you. So if it is something that you need to do next day, you write it down and leave it on your desk. You are up in the morning, you take a look at that and you know what you need to do. So it's out of your brain. Something that is bothering you, you write it down, you rip it apart and go to bed saying you've taken care of it. So these are some of the measures that we generally advise people, advise patients.
That was actually quite insightful and helpful. Sir, I just want you to just give some tips according to the corporate world, as you have a more experience in it. So can you please, you may have experienced a lot of situations where you feel burnout, and what tips you followed, to overcome that? If you put in, 1-2 minutes, as we are running out of time.
Sure, I'll keep it short, right? Two things. One is, if you are already in stress, or if you are experiencing stress, I think, to reverse the situation, the best thing what you need to do is you need to first acknowledge that you are in stress. And this stress actually gives some cues and, some symptoms, probably feeling undervalued, or if you're not happy with the work on a continuous basis. And then, if you're not getting recognized, as our panelists shared earlier. And then if you're not able to take break right in between, and there are too many things on your plate all the time, right? Then that's when, those are the indications that you are getting into stress, right? You need to just do a self-evaluation, self-assessment, self-actualization, and then understand that you are getting into a stress mode, which can lead to a burnout. Now, a couple of things what you can actually do, and also one is reversing. Second, also turning it to a successful and a positive situation. One is, if you think it is a role which is impacting you, then probably you need to understand, what is the gap in the role, right? If there is a certain skill which you're not able to acquire or learn, which is actually creating an issue, then probably spend little extra time initially to learn that skill so that you are 100% fit for the role. Second, if you are under a toxic manager, a manager who's not really supportive, right? Yeah. Then probably you need to just call out. And if you look at the organizations, like most of those high-performing organizations really take this very seriously, because it directly connects to their profits, they connects to their overall organization culture. Now what this organization does is they roll out employee service, they call you for focus group meetings, they ask you, literally they want an honest opinion and feedback from you to understand what you're going through, right? And then there could be various open-ended questions asked to you. Now you need to be very honest and then share what's running in your mind, what kind of experience you are having at workplace, so that the organization can take those feedbacks seriously and then work on it. One of the reasons could be a toxic manager. Now if the entire team reports that this manager is not really a great manager, is not supporting, then the organization has got various measures to tackle that situation. Either help that manager to understand, take the feedback and work on the manager development plan. Or maybe to extreme situation, ask the manager to leave or convert that manager into an individual contributor role, right? If you are experiencing a toxic manager, then share the feedback, right? And if feedback is not considered, in a couple of cases it may not be considered because it could be only you who's experiencing that kind of syndrome, right? That kind of behavior. Now in those cases, probably just seek out to check if there are other opportunities within the team or outside the team under a different manager. There are many people who change roles or change teams in the organization. We don't really understand the importance of it, right? It really helps you to completely, instead of changing the organization, change the department, change the BU, change the team, right? That's another alternate option you got. And the third thing, extreme situation, if you're not happy, and if this is really a toxic workplace culture, and it is impacting your health, impacting everything, right, your family and everything, then probably change the career. There are many organizations here in India, right, in different various sectors, and do a proper research to understand what those organizations are about, what kind of culture those organizations have, and then make a career change, right? One of the recent, the McKinsey survey, the recent McKinsey survey has found that the great resignation, which you would have heard recently, right, where many professionals have changed the job, was purely because of this burnout and stress.
Yes.
Right? Organizations have not realizing that this is actually killing their productivity. It takes a village to hire a person in that role and get it productive. So that way, employers really, it's really cost effective, if they kind of retain the employee and keep that employee engaged, all the time in that particular role. So my suggestion is, one is, keep asking the why part in your role, because what happens is, if you get into a lot of tactical stuff and miss out on strategy, again, you could be a junior employee, right? You may not really get into strategy, but still you need to understand whatever you're doing is connecting to the larger purpose of the organization. The moment you understand that, okay, this organization, this BU, this team is driving a larger purpose, and whatever I'm doing right now connects directly to that particular larger purpose, then your work becomes more meaningful to you. You will get highly engaged, right? And then you start producing that results. You don't feel burnout, you don't feel stress. The moment there is a disconnect between what the why part, what the organization wants to achieve, and what you're driving, if there is a gap, that creates a lot of stress. So one is understand, have open-ended questions like, ask these questions to your manager, why I'm supposed to do it, for a better understanding. And second, the other thing is, have curiosity, right? Curiosity kills, if there is any, there is no clarity in the role, curiosity helps to bring that clarity in that particular role. So keep asking, talking to manager, and encourage yourself to participate in those meetings and service, and share the feedback. If the feedback is not considered, move into a different team. If the organization is really a toxic workplace, then probably find some better organization.
So definitely, in short, you need to choose where you have to work and how you have to work and for what you have to work. So all the panels have given a very insightful thoughts and definitely a good tips. Now I would just like to take two questions from the audience. So anyone from the audience who, can you please give the mic? Please address to whom you want to ask the question. And yeah, they can give. You can take this mic.
I have a question, ma'am. Yes. Is burnout syndrome is a temporary or permanent, and how to self-diagnose it?
So to answer, the question was, is it temporary or is it permanent? So burnout syndrome is temporary because the factors that cause this are external, so they can be dealt with. So it is a temporary thing.
Yes, definitely.
And then, what was the second part?
How can
How do you recognize and what do you do? So there are, there is a self-assessment, a questionnaire called MBI that a therapist can do it for you. If you do your own self-assessment, they are not typically accurate. So it's better to go to somebody who can do that assessment for you.
Yes.
And not do it on yourself. Yes, the stresses, like how the panelists mentioned, it's important to recognize that and not ignore those symptoms. And also, if I were to add here, like how he was mentioning, how it is important to communicate. And also, it is sometimes quitting is not an option for many people. So what do you do at that point? So you have to make wise choices. So we all know that there's a rational mind, there's an emotional mind, but there is something in between called the wise mind. How do you tap into that wise mind? The skills that are required for that, again, you need to go to somebody who has expertise. Yeah, so it's important to be wise about your decisions. I know there are a lot of opportunities out there, but they are few and far between. You might not get them at the right time when you need it. So so it's important when you are facing a burnout syndrome not to be impulsive about your decisions at that point.
even if it has happened, then you can prevent it from not happening like repeatedly.
By tapping into resources and
Yes.
talking to people and all of that, and also give yourself some time.
Exactly.
Yeah.
Hope you got your answer. Anybody else?
Yeah.
Sure.
Good afternoon, the panelists and ladies and gentlemen, the audience. My question to Ms. Pratibha is, how critical do you think is burnt out syndrome with the kids in India as of now? And one more question to Dr. Lavanya. Would you suggest a regular, diagnostic therapy, like we have a diagnostic test done for sleep therapy as well? Thank you so much.
So it's really important that children from early on recognize this. Unfortunately, our education system tends to put a lot of pressure on them for performance. We need to, as adults, be responsible enough to recognize that and guide them, saying that this is not the only way of educating yourself. You need to be able to balance that as well for students. Making sure that they are doing activities apart from just studying to make themselves physically, mentally healthier. So it's critical that there is a balance in their lives, and because a stressed individual from early on might not have the skills to be a better employee later on. So these are things that need to be inculcated early on. I'm glad you asked that question. So it's important that schools have that in mind constantly, not pressurize the kids to a point where they feel burnout and they're ready to give up and not do their best. So the idea is to do your best within your capacity and take a break wherever possible. Yeah.
Okay.
The
Thank you
last
so
question.
much. Hope you got your answer.
One more question.
Yeah, the second question. When you say diagnostic therapy, do you mean a sleep study or just an evaluation by a doctor?
Sleep therapy as well as an evaluation.
Okay, so we don't recommend a sleep study for everybody who walks in with a sleep issue. First, we talk to them, we see what the underlying disorder is, what could be the underlying disorder. So we evaluate with lots of questionnaires first. There's Stanford questionnaire, there's Pittsburgh questionnaire, there's Epworth sleepiness scale, which is very commonly used. So after all this, if we think there's an underlying organic sleep disorder, that's when we recommend a sleep study, because sleep study it's a cumbersome procedure. It's an overnight study where either you'll have to go into a hospital, which is called a lab-based study, or a technician comes home with the device, with the equipment, and hooks up with all those monitors that we need to monitor throughout the night. So it's 1 night long, and also it is expensive. It costs anywhere between 10 to 15,000, and most of the insurances don't cover it as of now. A CGHS does, but it's very minimal. You'll be paying out of pocket. So we don't recommend unless it's really needed.
Yeah. Shall, shall I go ahead?
Yeah, please.
Can I ask a question?
Yeah, we will consider a last question as we're in of time.
Sure. Thank you, Ms. Pratibha, Dr. Lavanya, and Mr. Shafeeq for sharing all your valuable thoughts on burnout syndrome. My question is according to WHO, out of 1 in 4 adults do not meet the global levels of physical activity, and and they recommend minimum 150 minutes to 200 minutes we need to do that activity per week. So my question to all of you panel members, how many minutes you guys spend in physical activity per day, each day?
Okay, so I'll address this. I try to spend at least an hour every day, at least 5 days a week. So it's really important for me. It has become more of a coping strategy as well, because exercise takes me away from what I'm doing and also is good for me. I'm able to be with my thoughts, process them sometimes, and even ignore them. So it's important to take that time, and also it helps you overall. So it's the recommendation is anywhere from half an hour to an hour every day, if possible. Yeah.
How about you, Dr. Lavanya?
Yes, I agree with Pratibha. 40 minutes is the recommended. When you say physical activity, you mean exercise. So 40 minutes, 5 days a week. Even nowadays, now they're saying even 3 to 4 days a week at least. But if you could get 5 days a week of workout, that will be good. And it helps sleep also. So I mentioned that.
Yeah.
We'll take 2-3 more questions
exercise,
because
Shafeeq?
We can?
What is
audience
that?
have more questions, so we'll take 2-3 more questions.
Considering. Okay, guys, so we will take more 2 to 3 questions. So anybody else? Hope you got your answer.
Yeah, got it. Thank you.
Okay, thank you.
Can I ask a question?
Yeah, sure, you go ahead.
Yeah, my question is for Mr. Shafeeq. First of all, I would like to thank all the panelists for the excellent and very important subject. Most of us in this room, I believe, we are from Hyderabad or the surrounding areas, where the culture of parties and the culture of chabutras, is very, very common. Now, the sleep deprivation is affected, to most of the people, the students, the employees, the entrepreneurs, everybody. So how does this thing impact, the burnout syndrome? And as an expert, what is the workaround for this? What changes the community has to bring in to address this subject? Thank you.
Yeah, I think the other panel members would be more experienced than me to answer this. But again, I'll put my efforts here. I think the discipline is something which is really important, especially when you're working. That you need to really decide if you're working and if your workplace, your company has given that flexibility for you. Decide what are those hours you're going to work, right, and stick to that particular pattern. You could have little late night calls. Could be unusual or it could be common. If it is common, then probably readjust your work timings to address those and try to attend those. Not prolong your working hours all the time. And second, if you are required to attend those social gatherings, decide which is more important for you, right? It could be a few social gatherings which are really required and which you can't just skip, right? Probably you need to attend those. And if you are required to go along with family, obviously you can't ignore that. But at the same time, keep in mind that this definitely will impact the next day productivity, because the moment you are in that late night party and then next day if you are supposed to report at work, right? And then obviously, since your sleep is impacted and you understand, that sleep impact, what it can lead to, obviously, and it shows it affects your productivity, right? And if this happens repeatedly, say in a week at least you are showing that you're not productive or you look, a little tired all the time at workplace, then obviously, you may not really contribute to your full potential in those team meetings, in those team gatherings, or in those, in those discussions where you are required to brainstorm, right? What does this brainstorm means? You need to really think through your inner self and understand the situation and propose a solution or come up with an idea. You won't be able to do this, if your sleep is impacted and you were kind of, just spending late night, parties and then, kind of impacting your sleep. So that way, I think it is really important that you drive that discipline, number one. Second, understand what is really important for you, which one you need to address first, right? Third, always put your family and your career is at the top, right? Both are important for you. The social gathering can come next, right? And if you are getting time over the weekends, you can definitely attend those. So the other thing which is really important here is, you know, you need to really take a break in between, right? I also heard from, you know, our panel here. So unless you don't take a break, you won't be able to do that self-assessment or self-actualization to understand where do you stand, right? Now, but the moment you take a break, what happens is your brain will help you think deeper, and you actually start thinking about something else apart from your work. Or even if it is related to work, you may not really get into those tactical, regular operational activities. You may think a little louder, right? You start thinking about where my career is going. You know, how can I really shape my career, and what else can I do so that I can fast track my career, grow in my career, right? So again, I couldn't address your Chabutra question, but again, try to prioritize, and then, you know, discipline is something which is really important here.
Yeah, so it's all about, yeah, please.
If I can add to this question and also to your question earlier, how to prevent student burnout, breaks are extremely important. So there is something called Pomodoro technique. Have you heard of it? How many of have? Yeah. So that's a wonderful technique. Basically, what it means is focused amount of work for a particular time, and then taking a 5-minute break. So it's half an hour of work, 5 minutes of break. Now that doesn't mean that 5 minutes extends itself to hours or something like that.
It
So it has
actually
to be
happens.
very timely. 5 minute means, okay, you go get yourself a glass of water. You go maybe, walk a bit, or something meaningful that makes you come back and not distract you too much. So that technique actually helps. Time management is extremely important. Self-discipline, like how he mentioned, is important, and also boundaries. In your social circles, have boundaries. Okay, after this time, I do not attend parties. Weekdays, parties are not, advisable usually, because your sleep patterns and other routines get disturbed. So have weekend parties, and have it during lunchtime, not late night. So if you have those boundaries set, you can enjoy a very a diverse, rich social life, but you're also able to function well at work and other areas of your life too. So that's...
Okay, so actually, so it's all about your priorities, choices, management, and self-care, the self-time you gave. Hope you got your answer. Any other question?
Yeah, I have a question.
Okay, please.
Yeah, good afternoon. My name is Syed Maqsood, and my question is for Dr. Lavanya. How do we change a sleep pattern, I must ask? For instance, we have heard a lot about the 5 a.m. club and the 4 a.m. clubs, and many times I have attempted doing that, but what happens is, even once I'm successful, then I feel ill for the next 2 to 3 days, and I'm not able to get into that routine. So from your existing routines, how do you successfully change to such pattern that you're able to wake up early in the morning?
So your biological clock is very strong, I should say. That's the reason why you're going back to your regular schedule. But you can train it. There are ways to train it. One is you should be able to get enough sleep. Even if you're waking up at 5 in the morning, you should complete your sleep and then wake up at 5. So I think you should advance your bedtime by how much ever time you need to sleep. That is one thing. And we do something called sleep advancement therapy. It's done in phases. So we don't do it at one shot. There are things, once we assess your sleeping pattern and sleeping schedule, we do that. The second thing is exposing yourself to bright light when you wake up. Open the curtains. We actually have lights also that we tell people to buy and sit in front of that light. This is mostly done for delayed sleep phase syndrome or jet lag or somebody who has severe circadian rhythm disorders. But in this case, just sunlight. But at 5, I don't know if the sun is up during winter, but expose yourself to bright light. You could take the help of caffeine in this case. So that way you can shift it, but it takes a while. It's not a one-day thing. It takes a while to train your biological clock, but it's still doable.
Okay, I hope you got your answer. One last question we will take from the audience. Anyone?
I have a question.
Yeah,
I have
please.
a question for Mr. Shafeeq. So Ms. Pratibha has talked about setting the expectations. So in the MNC culture or in the organizations, in the organizations, basically, I want to understand like how important it is to set the expectations upfront, and whose responsibility it is. Is it the responsibility of the employee or the boss or the manager? And the second question is regarding like is only the setting the expectation initially is enough, because often at times we have seen that am I audible? Okay. Yeah.
Yeah.
So often at times we have seen that at the end of the appraisal process, there are quite a lot of surprises. Like the employee might be thinking that he has been doing well and he's expecting good reward, but it comes as a surprise that his efforts are not recognized. So is it like setting the expectations initially and not reviewing afterwards, or do we need to have a framework to review the expectations in a timely manner, and how do we go about it?
Yeah, that's definitely a great question, and we commonly face this, right? We don't really want those year-end, surprises and go through that particular phase. So the best thing, and this is something which organizations are doing, may not be all organizations. The organizations encourages managers and employees to have a regular discussion about the career, right? Now, the moment you set, it actually starts from goal setting. You set the goals for the entire year, and while setting the goals, and this time is really a critical time for you to set the right expectations, right? So what you do is, when the goal setting is being done, what you do is you actually take the goals of your manager, also look at your organization goals and try to align your goals. While aligning those goals, when you have a discussion with your manager to discuss those goals, you also set clear certain expectations that, okay, this is what I'll be doing, right? And this is how I'll be doing, and this is when I'll be doing, right? Now, for example, if there are like 5 goals, you break those 5 goals, or those 5 goals kind of, are required for the entire year, then probably break those goals into quarterly goals, right? The moment you break those yearly goals into quarterly goals, it becomes a lot more easier for you to track it on a quarterly basis to what extent you have achieved. So when you are setting these goals, when you are having a discussion with your manager would also agree to what extent you can accomplish, what goals you are going to chase and what goals you're not going to chase, right? So that discussion becomes really critical and important for you to set clear expectations, and also important for the manager to set the clear expectations as to what he or she are expecting from you as an employee. So once there is a handshake between you and manager, okay, this is what I'm going to work, and even the manager agrees that, yes, this is what I want you to work, right? Now that script, that goal sheet becomes really important. There could be 5% changes here and there. If the organizations has changed certain goals, the manager may come back and ask you during the year, saying that we probably need to drop this goal and add this one. But it won't really change the entire list. So once the goals are set, then have a discussion with your manager regularly, at least once a month, and then track those goals. As I told you, if you break those on a quarterly basis, it becomes a lot more easier for you to look at those activities which connects to the larger goal, and then track those activities to what extent you have achieved. So when you talk to the manager, and your discussion with your manager should not be really that, oh, I couldn't achieve, and then just bend your face down and feel sad about it. No, you need to really, make it very honest, saying that, okay, this is what I could achieve, this is what I could not, and this is because of which I could not achieve, right? And then it is managers and organizations' responsibility to provide you with enough resources and support to make you successful. So finally, the moment you are successful, your manager will be successful, the organization will be successful. So in that discussion, you seek help from your manager, and also ask about what resources are required for you to help, which can help you to achieve those goals, right? So once that level of tracking and discussion happens on a regular basis, now who does this? Is it manager who's supposed to call for a discussion, or it is you? It depends, right? Now, if I were you, I would actually do it on my own, because it is about my career. If a manager is too busy or he's trying to ignore, I'm going to take that responsibility on me, because it is my career, and block his calendar and arrange the meeting and ask these questions and get clarity, right? In most of the cases, organization advocates and ask managers to do this on a regular basis. So my recommendation is do that on a monthly basis, if not at least on a quarterly basis, and track those goals which have been broken into quarterly basis. And then during the year end, you know what you have achieved, right? There won't be any surprises. Even if you haven't achieved because of multiple reasons, then you are not really expecting any surprise there, right? But at the same time, if you're tracking it, the best thing what happens is, the moment you see that, okay, my previous quarter goals hasn't been achieved, you may slightly put little extra effort, or you may change your strategy next quarter, and you may actually overachieve your goals.
So that way the entire year sets off really well, and then you are exceeding the expectations there. So set definitely the expectations with the manager at the time of goal setting or when the time of reviewing the goals, and track it on a regular basis. If your manager is not doing it, you do it from your end and make sure that those discussions are really happening.
So it's an individual who knows their individual potential to keep the expectations, and to keep a realistic expectation is the key to conclude that.
Yes.
Okay, so we will just conclude the session. Definitely, I would like to thank all the panelists, Mrs. Somu and Dr. Lavanya and Mr. Shafeeq, for all the wonderful insights.
Thank you, ma'am.